Good morning, everyone. I am Danielle Bagweyerman, the Senior Director of Impact here at CHIP. I'd like to welcome everybody for attending today. Our typical leader of this event, Chelsea, is on a much needed break from the office, so I am happy to step in her place. So I want to thank everybody for joining today. I'm always really excited to have our quarterly meetings so that we can really see the work that we've done. It blows my mind that we're already into the second quarter of 2021 because I feel like it was just New Year's a week ago. So today, before we get started into the agenda, I thought I would kick us off with an inspirational quote, channeling in Chelsea's energy. And really what these meetings mean to me is really a time for us to embrace all of the change and all of the exciting work that is happening in the continuum of care. I've been with CHIP for almost 5 years, and I don't think things have slowed down since I started. They've always been changing. And so the quote I want to give today is by Andy Warhol, and they always say time changes things, but actually you have to change them yourself. So I just want to leave us all with that because there is so much change and so much hard work that is happening in the CoC. So I'm really excited to share that with you all today. So today quick agenda, we will be going through updates for the COVID-19 vaccination updates for those experiencing homelessness. We will also provide an update and progress on our community plan to end homelessness and the goals within that plan. We will spend a little bit of time talking about the HUD 2021 CoC NOFA competition, which should be coming around the corner any minute, and also provide updates on housing funding. We will also spend some time going over our community report on the CoC governance structure. So for the last 2 years, we've been working with Clutch Consulting, and we're going to go over some of the accomplishments and lessons learned throughout our time working with Clutch. And then we are going to have an exciting council conversations. So if you joined us for the last quarterly convening, we had 2 of our Blueprint Council members where we did a little get to know you session. So we will continue that again today. So first off, I'd like to kick off with a topic that I think is still on everybody's mind, which is COVID-19 and vaccination. So there's been a lot of work around this, and it's really exciting to hear and to see a lot of progress when it comes to our vaccine rollout. So as part of the effort to ensure that everyone has access, earlier this year, Indiana Department of Family and Social Services did a crosswalk to compare potential access points and clinic opportunities available to healthcare providers that can administer the vaccine. So our local providers have been hosting vaccination clinics, encouraging individuals while on street outreach and in shelters, and healthcare partners are committed to offering the vaccine to folks in very low barrier ways. So today, first, we'd like to hear from some of our partners that are working in those efforts. So we've asked Lisa Crane from Pedigo, Lauren Canaday of Adult and Child, and Kay Wiles from HealthNet Homeless Initiative Program to share how their efforts have been going so far and to provide an update on what's coming next. So Lisa, if you are available, we're gonna kick it off with you.
Okay, I am on. Our efforts were going famously until we hit the brakes this morning. I'm sure most people have heard by now, the CDC and the FDA have put a hold on Johnson & Johnson vaccines. And of course, that's everything we've been giving. To date, we have at Pedigo have given 355 Johnson & Johnson vaccines. We have, up till today again, I had a clinic 3 days a week, a walk-in clinic. We didn't require appointments. It's free. We just would have people come in and get the vaccine, wait their 15 minutes, and they were free to leave. We were also hosting outreach clinics. Last Saturday, we gave vaccines at the Good News Mission. We were supposed to have one at the St. Vincent de Paul Food Pantry on Saturday. So I honestly think this is just a temporary hold. Hopefully, the CDC can get this all worked out. From what I understand, it was, 6 cases among 6.2 million vaccines given. Obviously, I want everything to be safe. And I'm worried that this may prevent people from wanting the J&J vaccine. So at this point, we're going to help our patients call 211 and get hooked up to get the Moderna or Pfizer. So that's kind of where we are.
Thanks, Lisa. Definitely kind of a wrench thrown into the plan today. Okay, and Lauren, I didn't know if you were available to provide an update from things from an adult and child standpoint.
I can, yes. So similar to Lisa, we also were using for those that were experiencing homelessness, the J&J vaccine. So we will be pausing on any future plans. We did do one clinic at the women's shelter a couple weeks ago. We have a much smaller amount of J&J vaccine. So we were able to vaccinate about 50 residents there, both women and men, and did it right there in the clinic in a couple hours. Same watch, they didn't have to have appointments. The shelter and the teams there helped us identify people and had them watch for 15 minutes and they were able to go. Overall, we have been running several clinics with Moderna since January. So we have partnered with our ACT teams and some of our outreach teams to try to identify patients that they could bring in quickly for us and get set up and help work through that for extra doses or just getting them in. So we've been doing kind of a two-pronged approach, but with our J&J and kind of specifically going out into the community, we've had one shelter or one outreach pop-up clinic. We're planning a second one until today made us pause. So, and similar, we've done overall about 4,000 vaccines in the community in the last couple months. And like I said, we work through our patient list and our population list with our teams to try to figure out patients that would also benefit, and we can help get in for the appointment.
And Kay, do you have an update from HealthNet?
Yeah, good morning. Similar to Pedigo and Adult and Child, we were doing some assertive planning to get clinics set up in all the shelters. And we're just beginning to plan like a blitz for those who are unsheltered. Hoping we could do these the week of 4/26, like get started. But you know, the minute you start to make a plan, it gets put on hold. So your quote was telling this morning, Danielle. So we're going to go ahead and continue to plan as though we will get the vaccines. We're working with FSSA and hoping that we'll get 100 per week. But again, we're really in some preliminary planning around that and then have to see what happens with the J&J vaccine. But we'll be working with the city and all partners to figure out how we can provide the vaccine to the unsheltered population. Like, you know, we're thinking of some kind of blitz or whatever. So, but need to coordinate location and logistics around that.
Great. Thank you all for everything that you've done so far and that you'll continue to do in looking to get everybody vaccinated that's interested in the vaccine. Okay, we are going to kick it over now to our community plan to end homelessness and to provide some updates on our plan. As a reminder, there are 6 strategic priorities in the plan, and today we're going to focus on updates for 2, 3, 5, and 6. There is work that's happening in for each of the priorities, but today we're really going to highlight the work in the first quarter around 2, 3, 5, and 6. So for strategic priority 2, today we're going to provide some really exciting announcement regarding some permanent supportive housing news and updates, and also some updates to coordinated entry. So under strategic priority 2, we prioritize expanding permanent supportive housing to serve more individuals than ever before in our community and ensure that folks have access to housing resources is really the main component of an effective coordinated entry system. So last quarter, we provided an update on our progress toward the developing of new supportive housing and presented the supportive housing project pipeline, which outlined the development of over 500 new units of supportive housing that will be in our system by 2024. We are really excited to share that in the last month, 3 new projects with a total of 96 units of supportive housing were awarded low income tax credits this year. So this is a really vital step in the development of these projects because now they have the funding to construct them. And so let's talk about each one of those. So construction is set to begin for these projects later this year, and they should all be completed in 2022. So congratulations to Compass on Washington, St. Lucas Lofts, and Hannah Commons. Compass on Washington is a partnership between Gratis Development, Horizon House, and Inglewood Community Development Corporation, and they have 36 PSH units. St. Lucas Lofts is a partnership between Inglewood Community Development Corporation, Merchants Affordable Housing, Outreach Indiana, and Adult and Child, which will be an integrated supportive housing project with 10 PSH units and 50 affordable units. And then Hannah Commons is a partnership between Adult and Child, Upholdings, and SEND, which is Southeast Neighborhood Development, and will have 50 PSH units. All of these projects participated in the Indiana Supportive Housing Institute, which is a partnership between IHCDA and the Corporation for Supportive Housing. The Institute is a really intensive training process that helps partners prepare a successful supportive housing project and speed up the process to obtain the funding necessary to implement their project. So if you haven't had the chance to be familiar with the Institute, it's really exciting. I know there are, every year there are really great projects. So it's really exciting to see these projects get funded through that. So the Indy CoC and the City of Indianapolis have been increasing our partnership with the Institute to help encourage more projects to use the Institute as a development strategy. So congratulations again to these projects and their partner agencies and corporations. Next, we're going to talk about our coordinated entry system. So the community maintains a commitment to reducing barriers to housing and ensuring an equitable access to resources to obtain and maintain permanent housing. So as part of that process, coordinated entry continues to look for opportunities to improve practices and policies. The system is always being refined to better serve those experiencing homelessness. In Q1 of this year, the focus was on the internal management of coordinated entry, and specifically the case conferencing process. So case conferencing is a weekly meeting between service providers and housing case managers to discuss challenges, to find solutions, to support individuals who are referred to housing, and to help those who have already been housed maintain their stability. Case conferencing revamped work groups spent the month of February and early March, identifying ways to improve communication, update housing documentation, increase productivity in the case conference meetings. And then the new case conference meeting process was just launched, I believe last week, beginning of April. So coordinated entry project manager Lisa Huffman has also been working on the development of the work plan to update Indianapolis's housing needs assessment to replace the VI SPDAT tool. If you have more questions about that, there's information on the CoC website. So definitely very important work. As part of the development of that new housing needs assessment, the CoC is going to be hosting a number of listening sessions and feedback opportunities. And we want to take a moment to highlight these sessions, specifically to get people with lived experience, and including people living in shelter or unsheltered, and those that are already housed in permanent housing. We really want to invite all individuals to attend these sessions to get some feedback on what they feel makes people vulnerable in our community, so that as we build this new assessment tool, we can really capture the experience of people with lived expertise as we create this new assessment tool. Providers are also going to have their opportunity to give feedback in developing a new tool. So please contact Lisa Huffman with more questions. This is a huge undertaking, I think, for our system, because once we create a new assessment tool, that's also going to change how we prioritize and how people get matched to the housing programs and services in our system. And then we can kick it to strategic priority 2 and 3. And I want to spend some time talking about increasing our landlord engagement and management and supporting stabilization in housing. So I'm going to kick it over to Rachel to do a brief introduction.
Thanks, Danielle. I appreciate your help on this today. Good morning. My name is Rachel Sample, and I am with CHIP. I've been working with the rapid rehousing efforts for the last year or so. I apologize, I'm looking down at my notes because I'm also sharing my screen. So it's just a little technology thing. So I am trying to do two things at once, and hopefully I'm able to do that successfully here. All right, so in strategic priority 2 and 3, as we work to expand the number of rapid rehousing units we have coming into our system, we also want to increase the available landlord partners that we are working with. So I'd like to just spend a little bit of time talking about that. And the first thing I just want to hit on, as I mentioned, we have had incredible, tremendous investment in rapid rehousing in the last year. A year ago, in March of 2020, when all of this first started, we had just under $2 million invested in rapid rehousing, primarily through the Indianapolis Continuum of Care HUD CoC grant. And since then, we have seen just this incredible amount of growth. So I just want to take a moment and just thank everybody, case managers, outreach workers, supervisors, executive directors, all those of you who work at agencies who have been working to start administering this rapid rehousing funding. We know that this has been an incredible opportunity for us, but we also recognize that it is an amazing accomplishment and achievement to house folks every day, as you guys are doing. So I just want to thank everybody. This slide tells the story of dollars, but it doesn't tell the story of the lives that you all are impacting every day in the work that you're doing. Obviously, with all this increase in funding, there's now this tremendous feeling of responsibility to serve the people that are experiencing homelessness, to respond to COVID-19. And we just want to recognize all of you who are doing that work and say thank you. If we had not had the ESG COVID-19 CARES Act funding CV1 and 2, we still would have seen a huge growth in funding because of our increase in resources through the DV bonus grant that we received as a part of the HUD CoC grant, because of the Youth Homelessness Demonstration Program funding, and because of an additional expansion grant that we received as a community through the HUD Continuum of Care grant. So we were already anticipating having a lot to do in 2020, and we obviously had even more than we anticipated. So again, I just want to really say thank you to everybody in the work that you're doing. As a part of strategic priority 3, we really talk about how we maintain and engage landlords, how we keep those relationships, how we expand to new relationships. And rapid rehousing is really the area where we were identifying the need for the most growth in landlords. As you can see, the growth in funding that we had really necessitated us to make some pretty big changes in our just traditional approach. We were going to have to do business a little differently than we had in the past. So through our ESG CV2 funding, and in partnership with Glick Philanthropies, we were able to start piloting a new landlord engagement tool called PadMission. And I'm going to have our colleague Amanda Wilkerson share a little bit about the journey that we've taken with landlord engagement, and more about our new landlord engagement tool that we've been piloting. So just one moment here, and I'll kick it over to you, Amanda.
All right, I'm off mute. Thank you, Rachel. Okay, so slide deck. Do I need to share that, or?
I'll get it, just a second.
Okay. I'm brand new to this, folks. Thanks for being patient with me. I appreciate you all. So like Rachel said, I am going to talk to you guys a little bit about PadMission. And just to introduce myself a little bit, so I'm the housing acquisition specialist, and I'm working with CHIP and merchants and the landlord engagement work group. And I'm also a member of Blueprint Council. So those of you who don't know me, that's who I am. And this is my contact information. If anyone needs to reach out or has any questions, always feel free to be able to do that. All right, Rachel, slide 3. All right. So again, like Rachel said, she really led us into this. What we've been learning over the last several years as we created the Blueprint Council, as we created the 5-year plan, and we've been working through, the increase in resources, all along we've realized that we've been access to affordable and available units in our communities, including Indianapolis, is disappearing before our eyes with low vacancy rates, escalating rents, narrower screening criteria, and property sales to owners. And as you can see there, as we continue to assess our community's need and strategically invest in funding into housing programs and other tenant-based rental assistance interventions, this is a very critical piece to increase our capacity. And I'm going to give you guys a pad mission demo here in just a minute. I just want to, again, what will pad mission help us achieve? So pad mission, for those of you who have not heard of it yet, is a web-based search platform custom built for homeless service systems to coordinate and enhance their landlord engagement and housing search assistance efforts. It facilitates collaboration, coordination, and information sharing among multiple stakeholders in the community. And it's also a closed system. So it's kind of like a closed Zillow or a closed apartments.com. We approve all of the users who access the system. And what it does is it enables landlords to market their properties and available units to prospective tenants. Additionally, we retain full control of the database, and our housing locator managers work alongside our landlord partners to add and update those property profile listings so that availability information is updated and accurate. And then case managers and housing program participants use simple or advanced search criteria to identify units available for lease and participation in the community's housing programs. We can go to the next slide, Rachel, I'm sorry. And so where we're at, like Rachel said, we had the opportunity with CB2 to get started with pad mission. And so we've really been a leader, Indy's really been a leader in this, right? We've already been coordinating strategy and engagement, setting up system level work groups dedicated to landlord engagement and retention. We've been providing staff responsible for recruiting and maintaining relationships, and assessing how the current environment has shifted landlord practices and preferences. Next slide, please. And so, so like what's next? So now that we've experimented with CB2, our inaugural Home Now, Indy, and Pad Mission program, we are ready to roll out Pad Mission more. So increased access for more programs, landlords, and users. And we also know that Pad Mission is just one tool in our toolbox or at our workbench, right? And so it becomes more impactful when communities also bring other tools to that workbench, such as landlord incentives, robust housing acquisition, housing location teams, coordinated housing navigation, housing case management, all strategically aimed at housing retention. So increased access to landlord incentive packages for more programs, landlords and users. Yes, we can go to the next slide here. And so I also wanted to just let everyone know like what's next and where will we continue to assess and collaborate and where are those decisions being made. So the landlord engagement work group is one area where the CoC is able to come together and we're able to continue working on those next steps. The Home Now Indy leadership team, Home Now Indy work groups, and the performance work group. So if you're not currently attending any of those work groups and would like to discuss user access to Pad Mission or community level landlord engagement, you can contact myself or Rachel. And there are those emails there, Amanda at Merchants Affordable and then Rachel at CHIP. And then I've got to share my screen and I am going to show you guys how to search for a unit in Pad Mission, which is what everyone wants to see. It's the fun part. Okay, so let me find it here. All right, are y'all able to see where it says search for properties? So when we first log into Pad Mission, it gives us a dashboard here, which is really helpful for us when it comes to understanding how our users are accessing Pad Mission, as well as helps us to give us some analytics around what types of units do we currently have in Pad Mission, who's accessing them, and what that looks like. We have some other reports as well, and so that's really helpful for us as we continue to manage, measure, and assess, and really define what those system needs are and do that outreach strategically with landlords. And so what we can do is search for a property really quickly. So if you were a participant or a case manager, someone helping someone who's looking for housing to enter Pad Mission and look for a unit, we can either just scroll through here and find some units that are available, or we could narrow our search. So we could choose Indianapolis. Currently, there's only one program in here, and that is Home Now Indy, but that's what we will be expanding soon. Bedrooms. Say we're looking for a 1-bedroom, and we can update the results there. And then this will show us the 1-bedrooms. So if we want to choose 804 through 806 North Oxford, as you can see, we have a picture here. It tells us which utilities are available, which one's the landlord's responsible for, or versus the tenant. It doesn't look like we have any pet policy information in here yet, or accessibility features. But it gives us the address information and helps us to be able to search. And then up here, you'll see where it says contact property. So this is a feature that allows communities to be able to allow either housing locator managers or participants, case managers to reach out to property managers. And again, property managers and housing locator managers are able to create these profiles. And I'm not sure what else anyone would be interested in seeing, but I think that this gives us a good overview of basically how we can use this as a way to, what this is our tool, it's our list, right? So it's a list like we've always had our list, but what it allows us to do then is to be able to collaborate as a community at that community level, right? And be able to really be able to get a vision of what units do we have available for different types of programs to be able to negotiate. And so that helps us to increase that access. So we're really excited about it. And I'm excited to work with more folks to open it up. And I'll kick it back to you, Rachel.
Thanks, Amanda. I saw a couple people in the chat saying they were excited about this. Yeah, we are too. So we're really looking forward to continuing to roll this out, and hopefully there'll be opportunities coming up soon for us to meet with that landlord engagement work group to discuss this more. I know that's where Amanda and I are really energized around getting together with that group again. 1 second here, I'm going to get my screen back to where it needs to be. Just one moment. There we go. We got it. You know, when you hit the buttons on the wrong order, it does not work. Fun fact. All right. Just one moment here. So we wanted to spend a couple of minutes talking about things coming up in 2021 for housing and services. So Danielle, would you mind introducing our next section?
Not a problem. So we continue to learn about more opportunities to serve those who are experiencing homelessness after they're housed, and we're really looking forward to hearing more from our federal partners about funding. So to kick off that discussion, I'd like to introduce Rodney Stockman and John Dorgan. John Dorgan has been with our HUD field office for many years and has recently announced that he's retiring at the end of the month. So I want to kick it over to Rodney to share a few words about John.
I'm sorry. I received the news of John's retirement as bittersweet. On the one hand, I'm happy for him that he leaves for his retirement in good health and he can enjoy a new chapter in his life after a career of public service, starting as a Vista and then on to HUD for over 30 years. On the other hand, I can't imagine the world of affordable housing and homeless assistance without his guiding hand and wisdom. I've known John for over 15 years and can't quite imagine this field without his presence. I first met John when I started ICDA in 2006 as the director of the Community Services Department. John came over to ICDA to meet me. After a good conversation, I'll never forget what he said to me as he walked out the door. Don't steal money and everything else we can work out. My immediate reaction was, wow, the bar is really low around here. But as time went on, I came to understand what John meant. There's always solutions so we can better deliver services and housing to people experiencing homelessness. John has always understood the importance of his work and his unrelenting role to support homeless assistance community. My image of John will always be of him looking up a reg in his tattered CFR manual with dozens of dog-eared pages. But mostly I see John as a dear friend. I'll miss our regular lunches in Indian Gardens, but I wish you well, my friend. Thank you for sharing your wisdom and for all that you've done to support affordable housing and ending homelessness. You've made tens of thousands of lives better. So with that, I'd like to introduce my friend, John Dork.
Thank you, Rodney. I believe you can hear me, and I have opened the video. So thanks a lot. I really appreciate it. I just wanted to say regarding my retirement, I can't believe it's actually happening. My career went really quickly, but I would like to say that in 1987, when the Stewart B. McKinney Act was authorized, and then funds were appropriated for the supportive housing demonstration program and for the permanent housing for the handicapped homeless program. I was assigned the very first grant in Indiana, INTH 88-001, and it was in South Bend. And a lot has changed since that time. And from the very beginning, the HUD field office was marketing. We were actually reaching out to nonprofit agencies, asking them to apply. This was before the CoC competition. And we would have weekly sessions and bring people in and talk to them. And we're no longer asking people to apply for our funds. There's plenty of competition. So anyway, be that as it may, it's been a great experience for me to be community planning and development representative first, and then the director, and with an incredible staff at the HUD field office. So it's bittersweet leaving, but I think it's time for the next chapter in my life. But in the meantime, you know, one of the most exciting things happening with HUD right now, obviously there will be a CoC competition this year, a full competition. I don't have any information on the timing of that, but it will be soon. And then, you know, we have the CARES Act funds. We have the ESG CV1 and 2, and getting those funds obligated to specific projects and expending those funds and showing Congress, who appropriated those funds, that providing funds to the local communities that can identify needs and develop local implementation plans is the best delivery service system. And so we show that by actually showing expenditures and having results. And so the HUD field office will be continuing to monitor that, to oversee that over the next couple of years. But the most exciting thing happening is the Home American Rescue Plan a program that was authorized, and it provides $5 billion for the home program, for specifically homeless and those near homeless, and through tenant-based rental assistance and development of affordable housing and actually services. So this is a very strange thing for the home program because it's usually just hard costs. And although there has been some tenant-based rental assistance. So we actually, although this program will be for Indianapolis, for instance, that means an additional $14.9 million that will be coming to the city of Indianapolis for this purpose. And really looking at, I think, some of the capital needs of our homeless service providers, and then looking at can we acquire and rehabilitate housing for non-congregate shelter, and then perhaps converting some of those to permanent housing. So I think there's going to be lots of opportunities with the home ARP program, and it's really time to start thinking about and planning for it. However, there's going to be a lot of need in the home program for alternative requirements and waivers and they're developing the notice now, and probably the notice and the implementation of the home ARP program will not be until fall. And I can answer any questions about that, but it's a tremendous resource. Also, the state of Indiana, there are 14 home participating jurisdictions in Indiana. They will all receive an allocation. As I said, Indianapolis is $14.9 million. The state, the balance of the state's appropriate allocation is $59.5 million. So that's a huge resource in Indiana that will be coming along to match our regular CDBG, home, ESG, and HOPWA allocations for 2021, and then continuing with the ESG, CDBG, and HOPWA CV programs. So that's where we are as an agency. I think if you have any questions, I can answer any. But we, regarding the CoC renewals for 2020, we are in the process of getting those grant agreements out to the city and all of the various 2020 recipients. So with that, I think I'm done. But I'm open to any questions.
Thank you, John. I really appreciate you being here today. And again, congratulations. As everyone's, if you're able to check the comments here, there's lots of well wishes for you there.
Yeah, well, thanks. One of the nice things about, I think one of the nice things about being at home and for the last year, and then as I ease out, it helped with the transition a little bit, but at the same time, I really miss seeing everyone. So I feel like I'm sort of slinking out the door. And so for that, thank you everyone for your comments.
Thank you, John. Okay, we're going to kick it back over to our strategic priorities from the community plan, and we're going to jump into updates around priority 5 and 6. So we continue to make progress in areas of understanding racial disparities in our system. The Blueprint Council has convened their racial equity work group to discuss national best practices around understanding disparity. We've also had development in our data analysis plans and implementation. So we will spend a little bit of time talking about that. So the CoC continues to dive into examining racial equity within our system. And we have this new phenomenal tool, this equity dashboard. The Blueprint Council and work groups were able to review the data and outcomes based on the data. So the tool itself, the racial equity dashboard, there was a lunch and learn a few weeks ago. If you weren't able to attend, it is on our YouTube channel. I think it's on the CoC or the CHIP Indy one, Rachel, both of them? Chip.
It's on the CHIP one. I'll put it in the chat.
Okay. It's a phenomenal dashboard, and the lunch and learn will really walk you through how to use the tool, how to kind of filter it down to look at things and to be able to compare equity based on length of time, like assessment scores, housing placements, that kind of stuff based on equity. In strategic priority 5, we identified the need for data analysis, data integration, and increased capacity to understand and manage our data so that we can better evaluate our progress. So the equity tool is one part of that. And I would also like to kick it over then to Sal. So Sal is our lead data analyst at CHIP, and he has been launching efforts to really advance HMIS data collection and data analysis. We spent 2019 and 2020 really laying the groundwork for efforts to standardize our data practices, including a data quality plan. And this year, the team's really going to be working to implement that plan and a huge plan around training and technical assistance for our providers, including best practice development and ongoing standardization and monitoring of practices to really take our data collection to the next level so that we can really understand our data and to be able to make decisions based on them. So I'm going to kick it over to Sal to talk about the plans in the HMS world this year.
Thanks a lot, Danielle. So let me just share my screen. Apologies, everyone. I'm a lot more used to Teams. Oh, wrong one. Apologies about that. There we go. Okay, so really quickly, everyone, thank you so much for hopping on. So like Danielle had mentioned, I'm someone who knows the new, well, not so new anymore, lead data analyst. And one thing that we wanted to do this year that we are really concentrating on is a very internal process. So it's come to spring, and think of think of the next couple of quarters, think of the next couple of months as spring cleaning. And in order to make our our system scalable and something that we can build upon and have work consistently, we're going to be doing a lot of internal work and a lot of consolidation in order to be able to have a better system that works across the board, that works consistently, and that can scale, that can take on more users, more projects, and increasingly more sophisticated methods of data collection. So we branded this plan the North Star year because we really are setting a North Star for where we want to get to. And what is entailed in that is standardizing system processes, and that's very much an internal facing effort where we are going to be working to standardize, consolidate different records in the system, but I'll get to that shortly. Then we want to work on setting clear expectations, guidance, and troubleshooting assistance to the general community. We are also going to be working on improving training, changing how we're going to conduct training, and also keep an eye on knowledge retention so that when your users come out of training, it just doesn't sort of all go out the window. We want to be able to build on top of the knowledge that they receive upon the first time coming through training. And then the far end goal is for us to be able to provide y'all with a structure for data and change management. So HUD changes their data standards just about every 2 years. That's where it's been coming down about. And as different initiatives come through, we also want to keep in mind that they may add on different expectations, different data collection requirements. So those are things that we are cognizant of, and they're hard to take on when it's just your own agency yourself, and you may not have the full skill set to be able to necessarily conduct the change. So we are really looking to improving to helping to provide different strategies to address that. And then I'll talk a little bit about the upcoming performance outcome process that'll be starting in May. So the North Star year, again, is a plan to standardize, consolidate, and clarify HMIS. And as I mentioned, we are going to become more sophisticated. Data collection requirements are likely to become more sophisticated, more dense as we go forward. We're going to have more projects to juggle, and we want to be able to do this in a way that's scalable and that is understandable by your users and that we can react to in a consistent way. So like I had mentioned, our goal is to implement these 4 different tasks, and we'll get into each one right now. So first off is standardizing system administration processes. A little bit of history. I'm not sure if y'all are familiar, but the HMIS team in Indianapolis largely worked with a consulting group called AtWorks. And AtWorks was our system administrators. They essentially, if we had a workflow or any kind of technical administration task in HMIS to develop, we would ask them to take the pass at it, to implement it, to make it go live. And part of the issue with doing that is that we never built up that institutional and technical knowledge. We would only be able to rely on the sort of materials that we provided at Works, and then what they told us they had implemented into the system. So the cycle of information was never was tenuous, right? It's not institutional. It's not in the team itself. We weren't able to cross-train people so that they understand the more advanced processes or the more advanced queries that are being pulled from the system itself. So one major goal of ours is to begin that process of the technical administration and bring it in-house. And we'll get into some of where we are in regards to that, but part of our other goals are to standardize forms for project organization and inventory creation and updates. We are also, again, like I mentioned, bringing workflow and form development processes in-house. We just wrapped up that training actually at the end of March. So we now have that skill set and those designer capabilities. And additionally, later down the line that we're starting right now and will likely go into Q3 is the consolidation of services and grants in the system. And the time frame for that is really going to be dependent on the complexity and the system disruption that may come from consolidating those services and those grants. And then we are also developing a data dictionary, but again, that is a very internal process. It's really there so that we are consistently calculating things. Instead of each person having their own methodology for calculating chronic homelessness, we come up with a definition that our programmers use to be able to consistently report out on those clients, no matter who's designing the report or no matter what dashboard we're talking through. Everything is going to have the same definition unless we say otherwise or indicate otherwise. So where have we gotten so far? So again, like I'd mentioned, 3 of our HMIS staff have now received full administrative and design rights to client track. We are now building up that knowledge base internally. So we are creating forms, creating queries, building up our subject matter expertise on the system itself. And in addition, we're starting to standardize a couple of processes. So we now have a project creation form that collects, inventory data, grant data. It really puts it into one place. I understand that before it would be a quick email that's sent out and then we would create the project. But the problem with that is that it doesn't create a great historical record. So we want to try to standardize things so that we have a historical record and that it can scale where we're not juggling multiple emails asking different questions. It's just one form, fill out that form, and we'll be able to create your project without issue. We have also implemented a project naming convention, which is really designed to help better differentiate who owns the project, who is what type of project is it, and what type of funding does this project receive. This was really designed because we ended up having the same amount of, we'd see 5 different 2020 RRH projects, and it's hard to differentiate as an administrator. And when we're looking at sort of performance level data, it's hard to differentiate between those two. So the naming convention was really done as an effort to help improve the user experience and help improve sort of that flash decision-making to recognize what a project is comprised of. Then we have also created a draft of a data dictionary and provided that to the CoC project managers. And one thing that we've started doing is for any new projects that are established, we're using the latest protocol for grant and project setup. So prior to this new process, whenever projects were re-upped for their grants or renewed for their grants, what would happen is that we would create a totally new grant exclusively for your organization and a totally new project exclusively for your organization. This creates a lot of bloat in the system. So we are now moving away from that and creating one generic grant that describes the type of fund that you're receiving. This has no impact to the services that you're able to provide. We'll ensure that you are receiving the services that you have to receive, that you are able to distribute the services that you have to distribute. But it helps for consistency's sake so that we don't have, multiple PSH grants for individual providers. It's just one PSH grant, depending on the source, with a preset set of services that we can then customize to the needs of each project. But we're really trying to bring everything to boilerplate so that we can better understand your project a lot better, and two, so that we can scale it and as more funds and as more resources come into our continuum. So going forward, again, we are sticking to this new project protocol. So we will not be creating projects year in, year out. Instead of a 2020 ESG-RRH project, it'll simply be an ESG-RRH project that will then be connected to a generic ESG-RRH grant. And you will not need to exit your clients at the end of the year. You will not need to re-enter them into a new project if they're rolling over. And this also allows us for the ability to better analyze that client's data. If they've been in your project for X amount of time, we're able to better calculate that instead of having this arbitrary end date. And one thing that we're heading into is a mass client deduplication. So starting this month, we're going to be deduplicating clients in the system. We have about 3,000 clients that need deduplication that we have matched their first name and last name. We have matched their date of birth. So we will be moving through that process, and deduplication really causes a lot of issues when it comes to case coordination and also to calculate that client's homelessness, because if we are not pulling in the full data set, the full client history, service history, and enrollment history, we may not be able to see the full story of what their journey has been like as they've experienced housing crises. And then, of course, we're looking to how to consolidate and reduce duplicate services within the system. This is a major issue, and it's an issue that we are approaching slowly because we don't know what issues may arise from doing so. So just know that we're looking to consolidate services and reduce duplicate services later this year. So another part of our role is to really be the translator for any type of HUD guidance. And one new role that we're going to start undertaking is developing better articles, better guidance for you to be able to use HMIS and to also understand what's required of your particular project type when entering data for HMIS. So we are really going to make an effort to further refine our knowledge base for you and your users, and to also improve our troubleshooting system. Right now, before it would typically be one person who was addressing any troubleshooting issues. Right now, we're trying to make our team cross-train so that the knowledge is spread across and not just to one individual person. And so again, the progress thus far, we've been building out our help center, and you'll see the link in the previous slide. So we're adding things about how to search for clients, how to add interested others, how to add certain records, basically a breakdown of the different functionalities that you can find in Client Track. And we're really going to be making a push in the next couple of months to further document the different resources and different functionalities you can find in Client Track. And then our team is also taking on help desk tickets. So we're trying to provide a wider pool than just one person, but that also, in doing so, many people are experiencing, they're getting cross-trained in different areas that they may have not been cross-trained before. So we're building up the support network, and it really does take time to sort of do the detective work and see what was previously set and how can we improve on that. So we are also changing, we will also be making our training a little bit more sophisticated in the coming. So for this quarter, all of our trainings took place on a weekly basis. We worked with users and would do a 2.5-hour session with them. We are now talking about chronic homelessness, literal homelessness, roles of how to protect your client's data. So we're going over a wider array of information and more topics that are particularly of importance to your clients and to calculating which clients may be the most vulnerable. So in the larger screen of in the larger frame of things, we are developing a consistent curriculum based on different project types. So far, we have bucketed the project types into emergency shelter, transitional housing, and safe havens, and then permanent supportive housing, rapid rehousing, and other permanent housing. And so those two buckets will then get further refined down. So we'll also incorporate different elements of SSVF, RI, and eventually street outreach. So that is the goal going forward. And what will help us in being able to modulate and make a more consistent slice of your project type is the introduction of a learning management system. We are looking to bring all of our training online, and we are likely going to be using a learning management system that will allow your users to be able to take the courses specific to the project that they are enrolled in. And if you have someone that's working in both emergency shelter and in PSH for whatever reason, you can then have them take take a video on how to document the housing move-in date, but also have them understand how to work with clients that are in emergency shelters. So this will allow us to be able to really let the user and let your organizations choose how much information your user receives as they get trained. And then one long-term goal that we want to have is developing a power user curriculum. And a power user, when we're thinking about that, maybe someone that does reporting. So looking to give them increased access to reporting tools in the system, whether it be through Query Designer or some other methodology that we develop. Now that's a further goal, and that'll come around. We'll have more information on that in Q4. So again, this is the progress we've made thus far. I had mentioned everything. We're talking more about literal and chronic homelessness and providing more context. And another thing that we're doing is collecting more consistent. We have a more consistent new user registration form. So we have better information in creating your new users, so that we don't have as many issues where we create a user but didn't give them access to a certain organization or a certain work group that they should have had access to. And again, I mentioned going forward, the next big step is moving our trainings online. And a farther down, the next step after we build out this foundation is to talk through the tools and methodologies for data management. And so what will be required in that is identifying power users at each HMIS participating provider. And again, those power users would be folks that you trust to run data, to be able to do the type of analysis or have the willingness to learn how to do some analysis on data in the system and data from your projects. We also are going, part of this role will also be to develop recommended practices for you all and developing documentation that you can take and alter as you need to fit your client's needs and to fit your organization's needs. And Again, another goal out of this will be to develop specialized workshops that will cover how to implement the recommended practices and how to best utilize data and change management practices for institutional knowledge building. So where HMIS this year is really the year that we look internally and try to refine our processes and try to simplify and make our processes so that they can scale. We want to be able to apply the same to you all so that as turnover occurs, as different projects get onboarded, as your organization scales or has to descale, then we want to be able to provide you with the ability to, with the sort of structure to frame that and how to document that for historical purposes going forward. So a couple of challenges that may push back our time frame is one's vendor turnaround. So if there are system fixes that we need that the vendor is dragging their feet on, that may come into play. That's already sort of come into play. We've been waiting for an update to Client Track 20 that hasn't come, so that sort of pushed back our training timeframe. But we're just going to address that by moving forward with Client Track 18 until we see a finalized version of Client Track 20. Then another thing is that the system changes are too severe. This is largely relating to consolidating current services and current grants. And then our staff is still developing their institutional knowledge of HMIS and also doing the data detective work of learning what the data practices of the past were. So this is more of a temporary thing as we are building our knowledge, but just understand that this was a bit of an impact when we looked to the system. There's also a bit of detective work in trying to find out which organizations were participating, which weren't, trying to piece together the history of our CoC. So really quickly shifting gears into performance outcomes. For our upcoming performance outcomes, we are going to be making not changes, but rather adjustments. So data will be available directly through a report in Client Track instead of being presented in a spreadsheet form. So I think y'all are used, in the past, you were used to receiving this information through email. We'll still send you an email. We'll still send you an email with a article that contains all the results that you need in spreadsheet format. But there's another option for you to be able to see this information live in HMIS. So again, for those of you that are not HMIS users, you will still be able to see the performance outcome data. But for those of you that are HMIS users, you'll be able to see that performance outcome data adjusted live as you make changes in the system, as you fix, as you complete client enrollments, you'll see that information change. So I think that's a huge win for being able to get feedback on the information that you're inputting into the system instead of having to wait X amount of days or X amount of weeks to see if the changes you've been making are actually impacting your numbers. And another thing is that drawdown data will be provided directly from the city. For the past couple of quarters, we've been requesting providers send us drawdown data. Sometimes that works, sometimes that doesn't. This past quarter, we have not received a lot of participation in that. We didn't receive a lot of submissions for drawdown. So we're just together with the city, we've asked them to send us a quarterly update of that drawdown information of both pending and approved funds. So whatever's pending will also be included. And for this next quarter, we're going to be looking at all data as of March 31st. So the process is going to start on Monday, May 3rd, and any information that you need to have updated will actually be in the system. So if you see that the harder to serve number is way lower, and it's because maybe you didn't complete all of the, maybe you didn't complete the disability for some of the clients, then if you make those changes in HMIS, you will be able to see that immediate feedback through your report in HMIS. And following that, the data dive lab will occur on May 19th at 1 p.m. So one thing I want to let y'all know is that the performance outcome process is very much an iterative process. We're looking to improve on it every quarter. We're looking to give you more feedback, more tactile follow-ups that you can do for your data. So that is our goal, to give you actionable items that you can actively work on, and really reduce the amount of like interpreting and reading. We just want you to be able to identify quickly, and we are going to be building through that and building the mechanics for that throughout the quarters. So if you have any questions, we have our HMIS help desk email right up here. My email is right there as well with my direct line. And our help center, again, is really developing. So please visit that for great information. Okay.
Great, thank you, Sal. All of these changes are very exciting. I mean, our entire HMIS team is kind of new and revamped in the last year. So it's really exciting to see the work that's happening in the HMIS world, and building this foundation to really make it so that the data is more digestible, easier to interpret, easier to adjust, so that every program can really understand their performance much easier and in a more simplified process. So in addition to building out our data capacity, we also wanted to spend some time sharing our final report on the Indianapolis CoC governance transformation work that began late 2018, early 2019. And it really began with the adoption of our community plan to end homelessness. So we began working with Clutch at the end of 2018, early 2019, and they have been like a second family to us over the last 2 years. So today we've invited them to talk to us about the progress that our community has made in the last couple of years from that governance structure. So I'm going to turn it over to Mandy to provide an update on the last couple of years.
Thanks so much. It's wonderful to be in front of all of you, and Danielle, that was such a nice introduction. My colleague Heather Muller has been, I think, most closely associated with the work, implementation work as of late. So it's been wonderful to reflect on the last couple of years, and so we're excited to share just, I think, a preview of what this final report ultimately looks like. In addition, what I hope we can end with today is talking a little bit about the particular moment that you're finding yourself in, that the entire country is finding themselves in, and what that means for Indianapolis and the opportunities in front of you. So go ahead, next slide. So as Danielle alluded to, this journey really began with you as a community galvanizing and adopting a new community plan. And I know that I recall how much energy went into getting to that particular plan. And a central feature of that plan was an acknowledgement that you needed to function as a collective impact system. And so one of the first things you did to activate that plan was to bring Clutch Consulting in and help you reimagine your governance and implementation infrastructure so that you could function as a collective impact system. So 2019 was really devoted to adopting and implementing that collective impact structure, which is how many of you came to sit on this, the Blueprint Council. And I just want to give a tremendous shout out and so much credit to the former Blueprint Council who really understood that moment and led with such conviction to completely transform the Blueprint Council and the overall governance structure, which also meant that many of them were giving up their seats on the Blueprint Council to reposition themselves as leaders within the system elsewhere. And that's a rare thing in a community. And I just want to applaud them and acknowledge that incredible act of leadership to bring you through the 2019 to this very moment. 2020 by design was intended to kind of activate that new structure and reimagine the way your homelessness response system was designed. It was intended to do some stress testing and some refinements, but I'll tell you, none of us could have predicted the kind of stress testing that you were going to find yourself in as a result of a global pandemic. But you were able to take some of the initial lessons learned and this new structure and really apply it in an incredible way and fully test all the features and limits of your new system in preparation for what I think is an incredible moment in 2021, which is to truly scale implementation to meet all of the objectives of your community plan. So that's a little bit of the journey thus far. Next slide. I want to take a moment and really dig in a bit deeper related to the system transformation and the process that we implemented in 2019. So as we stated, it started with a governance restructure, and the importance of that restructure was really to reposition the Blueprint Council to have the authority to align resources and activities across multiple sectors in support of the community plan. It's not that the previous leaders on the Blueprint Council didn't have that same interest in leading the community plan. We just needed to make sure that we have developed layers of leadership and implementation structure so that we could fully harness all of the power that was necessary in order to fully implement. And so the restructuring of the Blueprint Council initiated a cascade where we were able to assemble high power leaders over multiple sectors, and then organize layers of leadership and work groups underneath that allowed for that cascade of authority to empower a larger structure to drive on the community plan. I often kind of talk about it in shorthand as the Blueprint Council really now can clear the runway for the implementers, and that's the power of that restructure. We also spent a lot of time really thinking about what it meant to build an implementation structure and to activate an implementation team within CHIP and its adjacent partners so that you could actively drive policy and practice change in the field in order to produce the system that you desired. So you now have a dedicated team of project managers. You have an entire structure of implementation work groups that are constantly acting, testing, looking at data. We talk often about this reinforcing engine of success, this idea that when folks can come together, they can think together, they can act together, they can evaluate their results, that this engine of success is how you propel these human systems forward to activate as large-scale social response systems. So you now have an implementation team that is really building their muscles and learning how to be incredible project managers and facilitative leaders. And you have a provider network that have leaned into this work group structure and are themselves learning how to drive policy and practice change through action. We also spent time really focused on funding alignment, and I think you've seen the fruits of that in the last year alone. So both public and private funders were brought to the table in this process to join in appreciating a shared vision, but really thinking about the scale that it was ultimately going to take and how to systematically approach equipping the system to reach scale, and how to invest and enhance the system infrastructure that was going to be required. Not just, how do we get more housing units or how do we get more interventions, but how do we really invest in the infrastructure to support a system at scale long-term. And finally, we focused on political alignment. I think it's always challenging when you're thinking about large-scale social system transformation. It's always challenging to meet some of those, what feels like very immediate or short-term political needs. And I think what this process has revealed is that there really is a shared vision for how the homelessness rehousing system can meet both political and community needs in the short term and the long term. And the structure has intentionally been designed to appreciate both of those needs and to create space for both of those needs to be met with the same shared vision. Next slide. So as we proceeded through all of those stages of transformation, one of the first things the community did is come together and really conceive a vision for how Indianapolis wanted their homelessness response system to function. And this we in our original recommendations, we said create a blueprint for your blueprint, but ultimately this is your system design that provides the guiding principles for how your implementation infrastructure acts on a day-to-day basis. It's all toward advancing this particular vision. Next slide. So we then really focused a lot on performance, and I'm sure you've seen over the course of the years the implementation infrastructure. You have an appreciation for all the different moving parts in your system, and what I wanted to do was boil this down to kind of a top line system accomplishments between 2019 and 2020. What we were focused most on was testing how to enhance the system, how to work to meet that vision. And I think there were two particular data points that surfaced as a result of all of that experimentation and all of those refinements. And it's first that you learn how to really maximize the use of your housing inventory through active management within these work groups, through the project management and facilitative leadership of your implementation team. You were able to increase your permanent supportive housing utilization from 79% to 95%. So not only does this have value simply because you're housing more people, you're using the inventory in your community, but this directly translates to increased points on your continuum of care scoring NOFA. So this type of performance and utilization translates into more competitiveness in the federal competition, and ideally more dollars over time. You also learn how to house people faster. I would say this is one of the most important metrics for a large-scale social response system that's responding to human crisis. The faster we can house people, the faster we can start to reduce trauma, the faster we can enhance health of those individuals and health of our community. And I'll tell you, it's no easy task increasing the time from, or I'm sorry, reducing the time from referral to housing. There's so many complicated steps that take place in this process that are in many ways outside the control of any of the individuals participating in this. So to come together as a system, to use this work group structure, to actively tweak and identify ways to enhance the system's own urgency around this particular metric is really a great testament, and I think established a wonderful proof point for everyone involved that this way of doing business, of coming together in this structure and thinking about a collective impact goal, like how do we move people faster, really can have a very dramatic effect on the system. So you can see in order to make these two things, these two top line system accomplishments possible, there were a variety of activities and refinements that had to take place. 17 kind of key refinements in the coordinated entry system, which is ultimately the system that's responsible for assessing, matching, and assigning all of those exit pathways to those experiencing homelessness. You had to redesign and expand your outreach teams. You had to enhance and expand your rapid rehousing program model. You had to test new system level unit acquisition strategies and secure rental units in a very different way than you had previously. You had to think about how to connect your efforts around ending youth homelessness and ending veteran homelessness to reinforce these same system performance measures. So this is this was the stress test, some of the testing opportunities that this new structure immediately afforded your system, and you started to see some really incredible results. Next slide. What we hadn't anticipated is that not too long after you got this structure in place, and I think only really a month or so after you as a new Blueprint Council even came together for the first time, you had a global pandemic and you had to meet that moment. And I think one of the most powerful things that happened is you had a structure and you had just enough practice to meet that moment. Not without stress, not without some angst, And that was true across the country. But you were able to really rally using the structure. You implemented a new type of emergency housing where 320 individuals have been served in non-congregate shelter over a 7-month period, which is really about infectious disease control and dignity, frankly, giving folks the space they need in order to manage through a crisis, whether that crisis is a global pandemic or whether that crisis is homelessness. You also leaned in fully to rapid rehousing as a recovery strategy. So what that means is, in a moment of crisis, instead of reverting back to the practices and behaviors of kind of an old way of doing business, you leaned in as a system to this new structure and these new activities and said, we can double down on this. We can use rapid rehousing as a recovery strategy. We don't have to think only about how to manage in this moment. And through the funding alignment work, and the partner alignment work, you were able to secure about $9.4 million in CARES Act resources to rapidly rehouse 500 individuals this year. That is an incredible move for a system that had just undergone so much transformation. But if you think about it, it was really the power of that collective impact governance and implementation structure that made that possible. You as a Blueprint Council could make quick decisions. You already knew across the board what the priority was. You already had decided rehousing is the priority because that's the vision that you've established with your system design. You had implementation project managers and work groups already in place that could lead and act. CHIP was fully empowered, along with its partners, to be the strategic leader for the system, and they were prepared and ready to act in that capacity. Providers had already practiced, and they were ready to act in concert from within these work group structures. And the funders were already aligned to the priorities and already connected to the system because they had come along and been part of that transformation process. So I look back and as I was kind of sitting in the national seat during the global pandemic and interfacing with all sorts of communities across the country, I'll tell you, Indianapolis stood out as a community that was so well prepared and so responsive to this moment that even the federal government identified that you didn't need as much help as others because of that, because you had so much pulled together. It was an awesome moment. Sitting, in background to watch play out. Next slide, please. So that brings us to this particular moment. It brings us to this new landscape that we're all navigating, and also to the next phase of Indianapolis's own transformation. So let's start with the new landscape. The CARES Act was pretty incredible. You guys put $9.4 million into action, which by comparison to what you've been receiving on an annual basis from your continuum of care, I mean, in essence, you're almost doubling your system's capacity with just that investment alone. And now we're met with an even bigger moment, that we have unprecedented resources on the table with the American Rescue Plan to make transformative investments and even end homelessness in places like Indianapolis. So you've heard a little bit already, I'm sure, about the HUD home funding for rental assistance and capital, but we know there's rental vouchers coming and there's flexible dollars coming from the Treasury, in addition to your regular ESG and CoC allocations and your CARES Act that you're currently implementing. So this is true for Indianapolis, it's true for everyone across the country in this moment. How we meet this moment is going to depend on the capacity of the system in front of each local community. And so I'll tell you broadly across the country, I don't know that any homelessness rehousing system is prepared for this moment. In all fairness, we lack capacity across the board. We don't have systems that have been designed for this level of scale. We've visioned it, but we haven't built enough muscles. We don't have enough providers. But the difference maker in the communities will be whether they've organized into a collective impact structure, whether they have the ability to stretch the capacity they do have to maximize this moment. And the communities that are well positioned to do that are going to take these dollars and make a very dramatic push toward rehousing. And the communities that are not as well positioned, they're going to take these dollars and spend them on new facilities for shelter. And both of those things are eligible activities. But at the end of the day, the difference will really play out in the number of individuals that are rehoused and the point in time count over the course of these years. So I just want to comment that your commitment with the CARES Act resources and even your struggles as you work to stretch your system to meet that new challenge, that positions you better to think big, to think creatively about how to maximize the use of these unprecedented resources than many other communities are positioned to do right now. So I'm really excited for you in that regard. It's also exciting because you've already identified what the next phase of your transformation really needs to focus on. And certainly this is not an exhaustive list, but I hope that it really helps appreciate kind of how much foundational work you've done and what the next increments look like and how powerful those increments could be. So one of the most important things is really focusing on performance management. And you just heard an entire presentation about how you're going to support and build the capacity of your community to meet this moment. It's also about really getting clear and focusing on targets. So this idea of we've got to house 500 people in a very particular time frame, that's exactly the type of energy and focus that needs to be brought to bear. And even taking that 500 and breaking it down into monthly goals and weekly goals and driving as a system. That's how you're going to kind of rev that engine and keep that implementation infrastructure moving your system and extending that capacity, maximizing that capacity. Really focusing on data-driven decision-making. So it's easy to get caught up in the way we think things are or the way things have been in the past. And these moments bring a tremendous amount of opportunity for learning. And when you start to behave a bit differently, when you start to have resources and scale, I've found that there's many things that happen in your system that are really surprising that I couldn't have predicted, but it was the data that really led us to see those things and to appreciate those things. So the more you can keep leaning into making data-driven decisions and not letting the data paralyze your decision-making, but rather empower it. So it's not going to tell you everything. It's not going to give you all the answers, but the more that you can lean into it and appreciate it and let it guide you, the more willing you are to make big moves and to take some risks and let the data keep bringing you back to truth and to success. And then I would say the last thing is you guys are still figuring out in particular how, when these kinds of resources become available, how do you really support the change management activities that are necessary to get everyone in a large system all coordinated. So, using your structure to do more to practice those change management activities. So more coordinated investment planning and more socialization among providers and partners within that structure is going to continue to build the muscles and the practice that's necessary to continue to scale your system over time. So I just want to close by saying there's so much more to applaud for what Indianapolis has achieved, and there's probably so much more to critique as well. Not everything that was tested worked, but I kind of tend to see a collective impact structure as not really allowing for any failure. In that, it positions you to learn continuously. So something may not work, but that unto itself isn't a failure of your system, it's a success. because now you've learned what isn't going to work and you have a structure that allows you to immediately pivot because you're so completely focused on where you want that system to land, what you want it to achieve. So, I am really excited for this moment for Indianapolis and look forward to kind of watching from afar and supporting you as we can and when necessary. So thank you. And I'm happy to answer any questions that folks may have.
Thank you so much, Mandy.
Thank you.
Okay, Rachel, are you ready to kick us off to the next section? We will have some question and answers at the end too. So if you do have questions that are formulated as we continue to go, feel free to write them down so that we can address them at the end.
I don't know what just happened. There we go. Okay. All right. So thank you again to Mandy and to Heather and to Clutch for all of their support since we began that transformation all those months ago. I want to kind of transition here to talking about our Blueprint Council conversations that we're hosting this month. And quickly introduce Angie Carr-Klitsch of Employ Indy, who is on our Blueprint Council representing the employment sector, and William Bumpus of Wheeler Mission. William is one of our elected representatives who serves as a representative of the crisis response system. And I was transitioning a little bit, so I believe I saw Angie. Did I see William on here too? Are you guys here?
Yes.
Hi, William.
Hello.
How's everything at the shelter today?
I'm not there yet, so I haven't gotten any phone calls, so I'm guessing everything's all good.
That's good. Are you going to ride your bike in today?
No, it's still cold outside.
Too cold?
You got to be like 70 plus for all that.
The first time I spoke with William about riding his bike into work, I thought he meant a pedal bike, and I didn't realize that he was a motorcycle rider. I was very confused and overwhelmed by the idea of riding his bike all the way from his house to Wheeler Mission downtown. So I was glad to hear you weren't pedaling all that way, William.
Yeah, I'm glad I wasn't doing that either. It's technically a three-wheeler. It's not a motorcycle.
All right.
Or not yet. I'll get one probably this summer though.
Well, William, can you tell us a little bit about yourself and what you do at Wheeler Mission for those of you who maybe don't know you, though I can't imagine anybody doesn't. It's possible, though, that somebody on the call doesn't know who you are. Yeah,
that's possible. Hello, everyone. My name is William Bumpus. I am the director at Wheeler Mission Men's Emergency Shelter. I've actually been there in June, it'll be 9 years in June. And I actually started off just at a difficult point in my life, and I needed some help and I needed some refuge. And I was looking for a job in between jobs, and a friend of mine said, hey, you can come work here. And I started at the overnight shift as a front desk worker. And I just kind of fell in love with the organization, fell in love with, the idea to get to help people change their lives. I know when I was at my lowest, I needed some help, right? So just being able to pay that forward and help people out is kind of how I got involved with Wheeler Mission. And I really enjoy being there and helping individuals experiencing homelessness.
Thank you. And I see Angie, you're on too. Can you share a little bit about yourself as well?
I'd be happy to. Good morning, everyone. Angie Carr-Klitsch. There's a Z in my name, lots of consonants, one syllable, blame my husband. I actually have a funny story in that when we moved here to Indianapolis in 2004, we were recently married, and I had no intention of changing my name. I like Angie Carr, it's easy, but we were living off of our last paychecks, and my birthday was in the summer. And so I had family write a few checks to us to help us get started in our new life, but they signed them to Angela Klitsch. So I had to go down to the federal building and change my name for $200, but it got us through that summer. And I'm Angie Carr-Klitsch now. So as I mentioned, we've been in this community since 2004, and I moved here specifically to attend graduate school. So the Lilly Family School of Philanthropy, as well as the School of Public and Environmental Affairs. I did a dual master's program in nonprofit management and philanthropic studies. But really, while I was doing that work in academia, I actually was interning at the Clues Fund, which is a small private family foundation, and had the opportunity to work with so many of our community partners and have a portfolio of organizations that I'm not sure, my memory does not serve me well, if CHIP was involved in that, but I obviously knew a lot about CHIP, not only through my tenure at the Clues Fund, but then also during my time at the Central Indiana Community Foundation, where I worked for 8 years and led family success efforts before moving to JP Morgan Chase. And I actually covered Indiana, Kentucky, and West Virginia for their corporate foundation that prioritized investments in workforce development, economic development, community development, and financial capability. And really, it was through that opportunity that I met several leaders in the community, and my name was lifted up to Mayor Joe Hogsett after he won his first election as a possible individual who could serve to lead the Workforce Development Board here in Indianapolis. And as of June 13th this summer, I will be in that position for 5 years.
Thank you. That's wonderful. It's wonderful to hear that story. I didn't know that about you, that you've been here since 2004. I am a fellow SPIA alum, so I appreciate that as well. Yeah. We have a couple of kind of rapid fire style questions. So Rodney, if you want to hop in on any of these two, you're welcome to. If you need to stay off, that's fine. I don't want to hog their time here, enjoying the visit with you all this morning. So you both kind of explained already how you came to be involved in the continuum of care. But can you guys, first, I guess I'll go to Angie first. Angie, could you tell us why the issue of homelessness is important to you?
Yeah, Rachel. I mean, I think I've been lucky just through my various positions in this community of always being abreast of data points and the reality of the number of our residents who are struggling to find affordable housing. And so really early on, recognizing that there was a swath of our community neighbors who needed additional supportive services to be rehoused and to be reintegrated, frankly, into the mainstream economy. And obviously that really continues to resonate with me in this role, knowing that Maslow's hierarchy of needs, that many individuals need to be stabilized before we at Employ Indy, representing the public workforce system, can align some of our supportive services, job readiness training, occupational training, and then that last mile connectivity to employers. So it continues to resonate with me, knowing that we need partners who are embedded as part of the continuum of care to help our neighbors stabilize and dream about a future. And then we as an institution can come alongside those individuals as they move to the next part of their personal education and employment journey.
And William, what about you? Why is the issue of homelessness become important to you?
I think that when I look back at my life and growing up, I tell people all the time how we as a family, we like moved every 6 months, right? So I experienced it. I've lived in hotels, I've lived in churches, things I dealt with growing up. And I remember, remember those feelings of not having nowhere, not having no help, it just seemed bad, right? So when I look at individuals experiencing homelessness, those that I deal with every day, I think about those times and know that in those times of need, we did have help and we did have people that were able to step up and give us places to stay, even though they wasn't ideal, right? When you think about homelessness, you think about having to sleep outside or going to a shelter or even a hotel, right? It ain't the ideal situation, but it's a place, right? You're not, you have somewhere to lay your head. You are good, right? So being in a position to help individuals and get them moving and get them on a good course to get their life changed and to end that homelessness and to get the needed help that they need is super important to me, because I don't know where I would be if people didn't step up and help with my situation or our family situation all those years ago. And just, being a helping hand to somebody, right? Being able to provide a smile, being able to provide a hug, right? It all the more helps that person understand and know that there is help and there is hope. And sometimes things might take a while, but everybody can come out of it.
That's awesome. Thank you for sharing your story. I'd like to ask you, William, can you share maybe a recent work-related accomplishment that you're really proud of, something that's happened at the mission or for you at work that you're proud of that's happened recently?
I think I'll be wrong if I didn't mention COVID at some point in this interview, right? I think that when we look at recent, I think just the whole COVID pandemic and how we, as an organization, as well as us as a community, right, we stepped in and faced those challenges and got people situated. And I remember when it first started, we just knew there was going to be a huge outbreak within the homeless population, right? But with all the resources and with all the help and with all the different agencies that came along, we were able to get people separated. We were able to get people moved out, and those numbers didn't get high, right? And again, I remember when it first happened, just the thought of what's going on. Nobody knew what it was, and everybody was scared. I call it that thing, right? Everybody was scared of that thing, and to see where we've come in this year, and where we've managed to keep everybody as safe as possible, and we've managed to house many individuals through this time. That's a proud moment for me, not only as an employee of Wheeler Mission, but again as a member of the CoC and the Blueprint Council, just to be able to come together and do that for those individuals.
Absolutely. And Angie, do you have anything you'd like to share, a recent accomplishment that at Employ Indy that you'd like to share with everyone?
I'd be happy to share several, but I think for brevity and purposes of today's conversation, I'd love to highlight the work that we've been doing with 16 to 24-year-old opportunity youth. So these are young people that are not employed and not engaged in education. It's not a homogenous group. There are obviously individuals who have not completed their high school degree or equivalency, but then there are those who have graduated from high school and lack direction. And obviously we know there's a significant leaky pipeline that continues, not even just in K through 12, but to post-secondary. So students who enroll their first year of college, but then do not continue on and persist. Our work with Opportunity Youth has really been empowered and enabled through a redirection of federal money starting in 2016 to this population. Youth funding that we used to receive historically had gone to in-school youth, 75%, and 25% to out-of-school youth. That flipped with the new WIOA Act that was implemented in 2016, and many of our counterparts across the country were struggling to really find this population to then thus serve. Because of Lilly Endowment support since 2004, we've been able to blend and braid those separate funding streams to really support 10 community-based organizations who are doing direct service work with that age group. We recognize that really to have more conversations, tactical conversations of like, what do you want to do with your life? What kind of employment are you looking for? We also have training that could help, that subsidizing can help you achieve that. You really need to develop rapport and trust. And this is true for any organization, right? So one of the things we did was really just kind of push DOL standards aside and say, we're going to invest heavily in work on the front end of really providing outreach and ways to connect. And in 2019, we started using the gym at the Finish Line Boys and Girls Club after hours, so from 7 to 11 p.m. with food provided by Second Helpings. And there was no requirements. You just needed to show up. It's open gym. We had re-engagement facilitators there, refs, who would start that dialogue. Within a month, we had 1,000 young people come to that open gym. Obviously, since COVID has hit, we've had to reorient what our outreach efforts are, and we're using a lot of virtual gaming. And are just being creative as much as we can to, again, create relationships that are really a necessary piece for a lot of the training and employment work that we're held accountable for and is our goal for the Marion County community.
That's so cool to hear. I know our service providers, as we have launched the Youth Homelessness Demonstration Program this last quarter, our new projects and everything, they've probably been experiencing a lot of work with that same population. So it's interesting and exciting to hear about your guys' developments there as well. That's very cool. I would love to ask you guys, what are you, Angie, what are you most looking forward to after COVID is behind us? Anything you're looking forward to doing when you can get out into the world again?
So my husband and I, we met in the Peace Corps, and my junior year of college, I studied abroad in Cairo, Egypt. So I really am just chomping at the bit to get my passport and maybe have the accompanying vaccine passport so I can, go see the world. Really, I'm looking forward to that, and obviously visiting friends who live all over the world as well.
William, what about you? What are you looking forward to?
I think I'm looking forward to sending my 16-year-old and my 4-year-old away for a couple of weeks. It's time for them they need a vacation, right? From me. So my 16-year-old has a boyfriend now, and I'm dreading, I'm polishing the gun almost every day, right? In case. So I'm dealing with that. And then my 4-year-old is a 4-year-old. And apparently I spoil her too much. So, just a break from them. I'll stay in the house if I can get a break from them. So, haha.
I'm seeing lots of nodding heads. I think other parents are ready for a little vacation as well, or they're ready for their kids to maybe have a vacation.
Yeah. We can send them to Chip for a week.
Oh, goodness. That's so funny. What about, what is something, William, that you think is going to be important for us to address as a community in the next 18 months?
I really think housing, right, is a continued thing that we have to address within the homeless population for several reasons. One thing that I've noticed, and one thing that we see with redevelopment in many neighborhoods, right, a lot of low-income housing and units and things like that are becoming more and more unavailable, which means that we'll start to see a lot of those numbers in the shelters, right, or in our programs or things like that, right? So, I always talk about we sometimes it takes a while to get individuals out of homelessness, right, or out of the shelters, and all that time, more and more people are just coming in, right? So it even though we house 35 people this week or next week, a lot of times it seems like we're not even making a dent, right? So the biggest issue I see is just having that affordable housing for anybody, coming out of homelessness. Coming out of their living situation, coming out of homelessness, all those different avenues, just having affordable housing for those individuals, because I think, again, here soon that our system is going to see a lot of that. And I think a lot of the strides that we're making as a Blueprint Council and as a CoC, right, is helping in that, right, with finding more innovative ways to house more individuals quickly and in different units. I think all those things are going to play a major factor in some of the things that we see over the next 18 months. Because I really do. I hate to say it, and I pray it's not the truth, but I see it coming. And, I pray that, we continue in our efforts to be ready for that task when it does happen.
Yeah. Angie, what about you? What do you see us needing to address as a community in the next 18 months?
So, as a previous funder and maybe still working in that capacity, kind of in a different role, it's hard to spend money wisely, particularly this significant onslaught that will not only be coming to the continuum of care, but to several other systems. How do we invest those dollars so that the systems and the integration that exists on the back end is something that will serve our community and our residents in perpetuity? So I said this yesterday, it is incredibly daunting to look at the dollar amounts that could be coming to our marketplace, but yet I can't think of better leaders to be represented in institutions to try to think creatively and long-term of how to use those catalytic one-time investments to ensure that we're not just meeting people right now and meeting their needs right now, but that we are making those requisite changes that ultimately will allow us to serve people better and more people in the future.
I appreciate that. It's good to know that our Blueprint Council believes in us and the work that we're trying to do. And you're right, it's a tremendous investment that's coming down the pike. So one last question before we just open it up to anybody else who'd like to ask questions of you two or of our session today. where do you like to go to eat here in Indianapolis when you're allowed to go out to eat? I enjoyed the restaurant recommendations we got from Pastor Green and Scarlett last time. So I'd love to hear where do you enjoy having a meal?
Going out to eat? What's that? Like, I just basically have stopped eating because I just can't make one more meal for my children. But in previous COVID times, we live in like the mid-north area. So I like to walk just down the street to 20 Tap and eat their cheese curds. It's my guilty pleasure.
Oh, they're so good. William, what about you? Where do you like to eat?
For me, it's Qdoba. I'm not a real big fan of people making my food outside of my vision, right? So Qdoba allows me to at least see what you're putting in my food. If you know anything about me, I can't stand onions. I think onions are from the devil. So I just want to make sure there's no onions in my food. So my staff talk about me. I literally eat Qdoba almost every single day. So that would be my place right there.
Well, that's good to know. I guess if anybody ever wants to get you a birthday gift, we know Qdoba gift card will always please William, will make
Always.
William's heart happy.
Definitely.
Thanks for playing along with that, guys. I appreciate your time today. And I'd just like to open it up to anybody on the call to ask any questions of our Blueprint Council members who are joining us today. Yeah, just we'll open it up from here. If you have any other questions about the other parts of the presentation, we can certainly discuss those as well. So I'll open it up. All right, well, nobody's immediately coming out with a question, but we're happy to hang on here for our last 10 minutes if folks need to skedaddle about their day. I'm gonna hand it over to Danielle just to close us out. Thank you, Angie and William, so much for your time today. It was a pleasure getting to know you a little bit better.
Yes, thank you to everybody who was able to join today, everyone who was able to share updates on our progress for the last quarter. I do want to leave us just with a quick closing quote from Alan Watts. The only way to make sense out of change is to plunge into it, move with it, and join the dance. So I hope that you are all around to help dance with us in this next quarter, and we will see you again in a few months. Thanks, everyone.